Hello and welcome to the Motivational Midwife. My name's Lynn Jones and I've had a request to do a session on HELLP syndrome, so that's what we'll cover today. So today we're going to look at HELLP syndrome then. So first of all, what does HELLP stand for? So it is hemolysis, so that's the breaking down of red blood cells, elevated liver enzymes and low platelets. And it's often associated with preeclampsia, although it can manifest without any of the normal signs that you would expect for preeclampsia. So blood pressure may be normotensive. Often it manifests between 27 and 37 weeks of pregnancy. So it tends to be later on in pregnancy, not so much the early part of pregnancy, which is similar to PET. And there's sort of 10 to 20% of women who have got PET. It also complicates the preeclampsia as well. And in terms of pathology, so what's actually going on, it's very similar to DIC, so that's disseminated intravascular coagulation. So disseminated means it's going throughout the body, intravascular in the veins, and coagulation, little clots. So very similar to DIC, but in the blood test, when you do the blood test, the thrombin times stay normal, whereas in DIC, they're not. And more concerningly, I think, is that, and we don't always think about this, is that, up to 30% actually occur following delivery. So in that postnatal period, most commonly, quite soon after the baby's been born. But it is a worry because we do tend to think that once the baby's born, that's it, problem solved. But this could manifest for the first time after the baby is born. So let's look at a little bit more at each of those elements of HELLP. So hemolysis, so that's the breaking down of red blood cells. So what's actually happening? So vasospasm causes damage to the endothelium. So that's the lining of the blood vessels. And as the blood cells are traveling through the blood vessels, they become damaged because of this damage to the endothelium. So you haven't got a nice smooth surface. So those blood cells become damaged. And the body doesn't want damaged cells, so it thinks, right, I need to get rid of these, so it breaks them down. So we have hemolysis. So if this is happening on a large scale, then it's going to interfere with the physiological processes that are going on. So for example, if we've got a lot of blood cells being broken down, then your oxygen transportation to cells is going to be affected, along with a lot of other things as well. And so then the elevated liver enzymes, again, we've got that vasospasm, which has caused the damage to the endothelium, and we get an aggregation of platelets. So aggregation just means that the platelets start sticking together. Okay, they form little clots to try and sort out the damage in the endothelium. So you get formation of microemboli, so little clots in the liver. I mean, it's happening everywhere, but at the moment, from the liver enzymes point of view, we're just focusing on the fact that they are happening in the liver. And this is going to eventually lead to ischemia because those little clots are going to block off vessels, and therefore oxygen is not going to get to the tissue, and the tissue will die, ischemia leading to necrosis, so that essentially tissue death. And this will result in an increase in liver enzymes. And so that's what you'll see when you do your blood tests. This is what's actually going on in the liver to cause that increase in liver enzymes. And then the low platelets. So again, we've already said we've got our endothelial damage, we've got our platelets all sticking together, you've got lots of tiny little clots, microemboli in the systemic circulation, so throughout the whole body. So all of those platelets are being used up in an effort to try and mend the damage, if that makes sense. So what might women present with? So epigastric pain, so that's kind of pain sort of here, right in the top part of the stomach. Lots of women actually have that epigastric pain. About 80%, I think it is, actually have epigastric pain. Most of them will present with epigastric pain. 50% with vomiting. 80% will have raised blood pressure, but then there's 20% that won't have raised blood pressure. Other signs and symptoms might be edema, haemolysius, so that's blood in the urine, gastrointestinal bleeding, so they might have hematemesis, so that's vomiting blood, or blood in the stools. They may have viral type symptoms, and because there is kidney damage as well, we'll get proteinuria. And because not all of the women will present with classic PET symptoms, it could be misdiagnosed as gastroenteritis or pancreatitis. So anything with an itis on the end is inflammation of. So that's inflammation of the pancreas, or cholecystitis, so sort of liver inflammation. And in terms of management, obviously if there's PET symptoms, they may well need to go on the full PET protocol. Bloods will need to be taken for a full blood count, liver function tests, uric acid, clotting studies. They may need serum electrolytes, creatinine and glucose as well. And in terms of urinalysis, you're looking at your PCR. So that's your protein creatinine ratio. And really what that is an indicator of how affected the kidneys are, how damaged the kidneys have become. Really anything over about 30 milligrams per millimole is really significant. So you want it to be kind of under 30. Most of these women will really need some sort of high dependency unit care. And they will need some sort of blood transfusion. That might be albumin, platelets, fresh frozen plasma. They may, if it's full-blown PET, they may need to go on magnesium sulfate. If their blood pressure is raised, they will need antihypertensives. Delivery will be dependent on the clinical situation, and obviously steroids may be helpful if the baby is preterm and she's stable enough to be able to wait and have steroids. So postnatally, these women are going to need a lot of support, a lot of debriefing, and it is important that women debrief with the appropriate people. So that may well be midwives and obstetric team, and the obstetric team should really sit down with them and have a plan in place for any future pregnancies going forward. And there you have it, HELLP syndrome. I hope that's made it a bit clearer for you. If you haven't subscribed to the channel already, please do so, and I look forward to seeing you next time.